complete patient assessment video.
Verify order for correctness and completeness. Select, gather, and assemble all of your equipment. Knock on your patient's door.
Hey, Miss Eddie, can I come in?
Hey, yeah, come on in, sweetie.
Hi, I'm Erica. I'm a respiratory therapy student. You doing okay today?
I'm good for now.
I'm gonna sit this on your bed.
Be sure to acknowledge, introduce, explain how long your procedure will take, and explain to your patient.
So I'm just gonna check you out today, get some vital signs from you. Shouldn't take too long. Is that okay?
That's okay.
As you enter your patient's room, remember to introduce yourself. Hello, my name is, and I will be your respiratory therapy student for today. Use appropriate infection control.
Miss Eddie, can you verify your name and date of birth for me?
Cecilia Eddy, February 5th, 1988.
Explain the procedure and duration of therapy.
So we're just gonna get some vital signs from you, and I'm gonna listen to you, and then go over some patient history with you.
Okay.
It shouldn't take too long, just a couple minutes. Okay.
Position your patient by providing privacy, comfort, and safety.
Are you comfortable the way you're sitting?
I am.
Can I move your pillow a little bit
Yeah,
for me?
just a little bit.
Good, okay.
Now you're going to move on to patient history.
Miss Eddie, can you tell me what's going on today?
Well, I was home watching TV.
Mm-hmm.
Then all of a sudden I couldn't breathe. So I
Okay.
decided to just go get some tea and lay down. But when I lay down, it got worse.
Okay.
So I sat back up again and it wouldn't stop. So I came in today.
Okay, and how long has it been going on?
Well, it's been going on for a week, but yesterday it was just really bad. So I just came in.
For about a week. And are you coughing up anything?
No.
Okay. Any pain anywhere?
Just in the right side of my back, that's it.
Okay. And have you ever had this type of thing before?
No.
Be sure to ask your patient's age, height, and weight.
Miss Eddie, can you tell me how old you are?
I'm 32.
Okay. Do you know how tall you are?
5'6",
Okay. Do you know how much you weigh?
fat,
In numbers?
just 210.
Okay.
Now ask about your patient's past medical history, any prior illnesses, prior surgeries, and medications.
Miss Eddie, have you ever been to the doctor for anything else?
No,
No chronic issues going on?
no ma'am.
Okay. Do you take any medications for anything?
No, I just drink a lot of tea.
Okay. And have you ever had surgery before?
Yes, I've had 2 C-sections and 2 corrective surgeries.
Okay. And no complications with those?
No ma'am.
Okay.
Be sure to ask about family history. That includes immediate family and extended family.
Miss Eddie, do you have any family history of any type of illnesses or diseases?
My grandma and my granddad had diabetes and that's about it.
Okay, and nothing, did either one of those die from those illnesses?
My granddaddy did.
Okay.
Now you're going to move on to vital signs. First, you're going to assess your patient's pulse.
Okay.
Correctly locate the radial, brachial, or carotid pulse.
Miss Eddie, can I just see your hand here? I'm gonna check your pulse, okay?
Measure the pulse for 1 complete minute if irregular. If regular pulse, measure for 15 seconds and multiply by 4.
Okay.
Correctly record the rate, rhythm, and strength of the pulse in your patient's chart. Now you're going to move on to respiratory rate. Be sure not to disclose to your patient that you're assessing the respiratory rate. Measure the rate for 1 complete minute if irregular, but if regular, measure for 15 seconds and multiply by 4.
So I'm just gonna put my hand on your chest here.
Be sure to correctly record the rate, rhythm, and depth of respirations in your patient's chart. Now you'll move on to blood pressure. Locate the brachial pulse.
Miss Eddie, I'm gonna take your blood pressure, okay?
Correctly size the blood pressure cuff. Apply the cuff correctly.
Make sure the brachial artery is over the artery line. And remember, if you can't locate the brachial pulse with your stethoscope, to not waste a lot of time on that and move on.
Measure the blood pressure during inflation. Measure the blood pressure during deflation.
Remember to open the valve slowly so the number doesn't drop quickly.
Remove your equipment correctly. Correctly record the blood pressure in your patient's chart.
Her blood pressure was 128/74.
Now you're going to move on to pulse ox.
Miss Eddie, can I see your finger, please? We're just gonna put this on your fingers. Just gonna check your heart and your oxygen, okay?
Correctly apply pulse ox to the patient's finger and assess the heart rate and the pulse.
You can just leave your hand still and it'll read it.
Okay.
Be sure to correlate your pulse ox values with patient manual heart rate for accuracy.
So remember, the heart rate you got when you were feeling for a pulse should be close to the heart rate on the pulse ox.
Now you're going to move on to inspection.
I'm gonna take this off your hand, okay? Thank you.
Inspect the patient's chest for respiratory rate and pattern. Be sure that the respiratory rate is the same as above.
You said no trouble breathing today?
Not today. I feel much better today.
Okay.
Inspect the patient's chest for work of breathing.
And no pain if I touch you. Okay.
Inspect the chest and be sure to check the spine for the spine, sternum abnormalities, accessory muscle use, retractions, and flail chest.
Miss Eddie, could you sit up for me?
Yeah.
I'm gonna put my hands on your back. Just gonna check your spine out. No pain or problems when I do
No.
that? Okay.
Inspect the chest for AP diameter.
You're just checking to see if it's barrel chested or really thin.
Okay.
Now inspect your patient's fingers for clubbing and capillary refill.
Miss Eddie, no problems with your fingers?
No.
Okay. No pain or anything when I touch them?
No.
Okay. Nothing on this side?
No.
Now you're going to check your patient's general appearance. Be sure to note any cyanosis, skin rashes, redness, or edema.
No problems with your skin today?
No.
No rashes anywhere?
You're also looking for the temperature, cool clamming to the chest. along
No
with the-
problems with your feet or legs?
No.
Assess your patient's level of consciousness. Note whether they are alert, they are alert to verbal stimuli, painful stimuli, or whether they are unresponsive.
Ouch, that hurt a little bit, okay.
Now you're going to move on to palpation. Palpate the chest to find areas of tenderness or subcutaneous emphysema.
Miss Eddie, I'm gonna touch your chest again.
Okay.
Can you tell me if it hurts anywhere? No pain, no
No.
tenderness anywhere?
No.
Palpate the chest to assess symmetry of chest movements.
Take a deep breath for me. Okay.
Now you're going to palpate the chest to assess tactile firmness. Be sure to have your patient repeat 99.
Miss Eddie, I'm gonna have you sit up again.
Okay.
I'm gonna put my hands down your back, and I'm gonna ask you to repeat the word 99, okay? Okay, go ahead.
99,
Again,
99,
and again,
99,
and again.
99.
Okay.
Palpate the
Just a
trachea to
second.
determine tracheal position.
No tenderness or pain when I do this?
No.
Okay.
Now you're going to move on to percussion. Percuss the chest using a systemic method.
Okay, so I'm just gonna tap on your chest, okay? Will you let me know if it hurts or anything?
Okay.
Be sure to use proper technique. Now we start with auscultation. Confirm the patency of the stethoscope by checking the bell and the diaphragm. Optimize the environment by turning off the radio or television. Ensure patient privacy during your procedure. Be sure to position your patient properly.
Okay,
Now
Miss
you're
Eddie,
going
I'm
to
gonna listen you,
auscultate
okay?
the anterior chest bilaterally.
You take a deep breath for me.
Be sure to use your stethoscope properly. Use a systemic method.
We're gonna go left, right, left, whichever order, so you're listening to the same lung field or right and left. To compare the sound.
Can you sit up for me? I'm gonna do your back, okay?
Be sure to use the same method while auscultating the anterior, lateral, and posterior chest.
Patients who are critically ill may not be able to do all of the points of sound, so
And one more
start where
time.
you know they are
Okay,
already
you
ill.
sit back.
Now you're going to auscultate the cardiac sounds. Be sure to auscultate the aortic,
Listen to your heart, okay?
the pulmonic, Erb's point, tricuspid,
Just gonna listen to your under brow line.
and lastly mitral.
And one more time, okay? Okay.
Now you're going to move on to your post-treatment task. Note important observations during and after treatment. Thank your patient for allowing you to treat them. Reposition your patient for safety and comfort. Be sure to clean up all trash and leave your workspace clean.
Okay, Miss Eddie, nothing I did today caused you any pain or discomfort?
No.
Is there anything I can get you?
Just a little bit of water that will be fine.
Okay. Would you like me to put this pillow back behind you? Okay. Are you comfortable?
I am now.
Okay. I'm gonna go put your vitals and everything we talked about today in your chart. You have a call light. If there's anything else you need, you just let us know.
Okay.
Okay.
All
Thank
right.
you. Have a good day.
See ya.
Properly remove your gown and gloves. Be sure to document everything that you assess and observation. Notify appropriate personnel of any adverse effects. Clean and store your equipment properly.